Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingel. Earlier this week, Christina was in attendance at a rally for advocates who were begging lawmakers and the federal government not to cut Medicaid. As we all know, Congress is getting closer and closer to passing the One Beautiful Bill Act, which includes some changes to how Medicaid and Medicare will be funded. But that means a big difference for individuals with intellectual and physical disabilities who may face more impacts than perhaps many realize. And that's what this rally was really about, right, Christina?
Yes. I think people think of Medicaid as specifically healthcare services. But when we look at someone who's living with disability or has a chronic injury or illness that's keeping them in need of consistent medical care or support, then it's a whole different story, because people are using Medicaid waivers to access services like physical therapy, occupational therapy, support aides who help people go out and work on life skills, navigate their jobs, things like that. So it's doing a whole lot more than just, paying your medical bill. And one thing that I think was highlighted in the rally that we don't often think about is that we used to have a lot of people who had intellectual disabilities in institutions because we just thought that was the best way to handle it. They needed a lot of care, so put them in an institution. What we found in, the past several decades is that not only is it cheaper for people to live in their communities and build their lives that way, but obviously it's much more satisfying for someone to have a life than to be in an institution. So when people don't have those supports that they need to be able to live independently and in a community, the only option then becomes to send them back to those institutions, which I think I'd say there's probably a pretty strong consensus among both people within the community of people with intellectual disabilities and outside of it that we don't want to just put people away in institutions when they could just as easily have a life outside.
I think one of the things that gets lost in translation is that when Trump and Republicans talk about making changes to Medicaid, they are looking at work requirements and things that would make it more difficult for able-bodied adult men with no dependents to get these services, because they don't want them to drain the services for people who truly need it, which they would agree are people with intellectual and physical disabilities. But even if those measures were taken, is there not a way to protect the services that they have for people with disabilities from being basically impacted by these work requirements and other things in other places?
I don't know if there is a way to protect them, but if there is, it's not what's on the table now. Like, what's being put on the table are these massive cuts that will affect absolutely everyone on Medicaid. And the Congressional Budget Office said this week, I think it was 10.9 million people will lose insurance altogether from these cuts. So it's going to impact a lot of people. And another thing that it will do is even just reducing federal funding, just reducing access will increase wait lists and things like that. Like, we have huge wait lists in Pennsylvania. There's over 11,000 people waiting for services that they are eligible for. That could be they're waiting to have an aid. One person spoke, Ernie Roundtree, and he had first applied for a waiver in, I think he said 2007. And it was years before he finally received some support. And with that, he got an aide who goes out and takes him to the grocery store and has helped him learn how to navigate his community. He has a job. He's able to do so many more things because of that one service that was provided through Medicaid. So when we have a crunch, when there's, less to go around for everyone, then we see these wait lists and stuff like that expand. So even if people are protected, even if their particular needs are still being met by Medicaid, their access to those needs is going to change. The same way that we've looked at, a hospital closure will impact people who have good insurance. It doesn't matter if you have insurance or not, right?
Yes, that makes sense. And even on a very basic level, I mean, we look at reduced cuts in other parts of the government. And now we have state parks that are closed more often because we just simply don't have the workers. It's not a sense of state parks are bad. It's just that cuts to certain areas have a trickle down effect or go beyond what they seem like. And that's just kind of the nature of how these government programs are funded and why DOGE has become so controversial in a lot of ways, and a lot of their tactics to reduce the size of government and to prevent fraud and waste. In your article, actually, you wrote about how the state does work on weeding out waste and abuse in the system, right?
Yeah, Pennsylvania is actually pretty notable in its efficiency with that. They do a great job. They even use AI to weed out fraud. So it's very hard to commit Medicaid fraud. And nationally, I think it's like 95% of Medicaid claims are real. They are not fraudulent, right? So, and even the 5% that aren't, like, I think a majority of those are just improper paperwork as opposed to being someone trying to scam the government. So I think it's maybe well-meaning to say, oh, we want to get able-bodied men off of Medicaid or, illegal immigrants, but the numbers just don't bear out that's just not where the money is going. It's going towards people that need it for the large majority.
Right. There's a metaphor that I've often heard used when covering government is that they needed to go in with a scalpel and not a sledgehammer. So that I think that applies here, that the cuts could be a little bit more targeted or a little bit better thought out in order to avoid these things. But of course, I'm not there writing bills. I don't know. But that seems to be the overarching lesson here that advocates are wanting people to understand, is that it's not as simple as, oh, we're going to new requirements come with new responsibilities, and those responsibilities cost money and without the money to support them, then it has to be taken from other places. And it's just going to have this cascading effect. So it's definitely something to think about and keep our eye on as this goes forward. Thanks for joining us today, Christina. To keep up with this story and more, follow us at thecentersquare.com/Pennsylvania.